as such.
Thank you, Etisha. Ma'am, can we
Thank you,
now
ma'am.
move on to OSCE session?
Yeah. So I want all of them to have pen and paper to write down. Is my screen visible?
Yes, ma'am. Your screen is visible. Can you please make it slide share? Okay.
Okay. All of you have a pen and paper. I'm not going to give you 2 to 3 minutes. I'm just going to give you 1 minute to write. So shall we start? All of you are ready? Okay, you can put in the chat box, but I want you to, as much as possible, take a pen and paper, write and self-correct. Am I audible?
Yes, ma'am. You are audible, ma'am.
Okay, okay. Shall we start now? Okay, so I have put 14 ASCIIs in equipment. So please take a pen and paper and write. And I would give you 1 minute to do, and then following which we can have a discussion on it briefly. Is that fine?
Yes, ma'am. I think students and nobody's put any answers. They have not put in chat box. I don't know. I think, ma'am, you are the co-host. In the attendees, if they have raised their answers, they can actually answer it if you want any one of them to answer.
Please write your answers in chat box if you have put that. But actually, what I thought is if one person is putting, then all of them will do the same thing. If they have a pen and paper, it is always better for them to, write it down and then correct on their own. Is
Okay,
that
ma'am. No
okay?
problem.
Is that better?
Okay,
Because
ma'am.
some enthusiastic person will be answering, and then everyone will get thought blocked seeing that
Yes,
answer.
ma'am. Okay.
So I actually, as much as possible, I do not want in chat box. Please take pen and paper and write it. We'll discuss. So shall we start? So this is your first ASCII. Time starts now. I'm going to give 1 minute for this. So 1 minute over. So basically, we are very familiar with like multi-parameter monitor. So the technology recommended would be signal extraction technology. So respiratory rate is recorded by ECG leads, and it is by impedance method. Because you have like various method to detect the respiratory rate as such. So impedance, the thoracic impedance is the one which makes the ECG leads recognize the respiratory rate. And before invasive testing, blood pressure monitoring, you will do a zeroing. Okay, shall we move on to next? Time starts now. What is this equipment? Name to indication for its use and what is the limitation? So hope all of you are writing it down. I'm hoping that all of you are having a pen and paper and writing it down. Okay, so it's correct. It is an apnea monitor. So usually babies who are at increased risk of sudden infant death syndrome, or baby who had ALTE already, parent life threatening event. So those are the babies who will go home apnea monitor. Neonates with bronchopulmonary dysplasia, once they are getting discharged, the disadvantage is it cannot detect obstructive apnea. So what is this machine? How do you calibrate? Where it should be attached in the circuit during continuing care to the patient? So maybe we can cut short a bit. If all of you have answered, I'm just going to the answer. Okay, so this is an oxygen sensor. So you calibrate it, the sensor at FiO2 of 21%. You keep the FiO2 of 21% and also 100% and see whether it is respectively showing it. Where it should be attached in the circuit during continuing care of the patient. It should be in the inspiratory limb, anywhere between blended gas flow and interface. So it can be near the ET or like nasal prongs, wherever it is. So sometimes you might feel that it is discrepant, whatever FiO2 is being delivered and whatever is showing. So that time it is useful to check with the oxygen sensor. So if you have written as oxygen sensor, then it is a full mark for you. So I'm sure you will know this mission. So what are the parameters to be set? What is the power and what is the Reynolds number and what is its unit? Okay, so the parameters to set include map, delta P, which is nothing but your amplitude, FiO2 and frequency. The parameters which are set in high frequency oscillator is very less. So this is a sensor medics for those who are not very familiar with the mission. So power is nothing but whatever is used for setting your delta P or amplitude. Basically, Reynolds number is the number to indicate whether the flow is laminar or turbulent. If it is more than 2000, then it indicates that it is a turbulent flow. It is a unitless number, which is derived by 2 into radius into velocity into density divided by viscosity. Next question, what is this? What is the about tube? Which condition is it used for? What is the advantage of this tube? What ensures correct placement of the tube? Okay, so this is a Replugal tube. So the condition used for is esophageal atresia with or without fistula. So basically the advantage is that, like, if you see here, you can see two ends here. So it is a tube within tube. Okay, so if you see the cross section of it, one of the tube is attached to the suction tubing, and the other is the air vent. Okay, so you can see that this particular thing, it has a, you can kind of flush saline, and it also acts as an air inlet, so that the tube does not get stuck to the mucosa of your esophageal end, thereby preventing esophageal injury. So if there is a continuous drainage through the low suction device, then it indicates that the Replugal tube is in place. Sometimes we can have an adapted Replugal tube by putting NG tube into the NG tube and connecting one of the NG tube to the suction catheter, and other tube leaving it as an air vent. So we can have our indigenous Replugal tube made as such. Okay. So if you have any queries in this, okay, someone has put a PD catheter, so it is a Replugal tube as such. Okay, so identifying equipment is your first question. If you have answered that, I'm moving on to the second one, because once I put the next question, you will know the answer as such. So it's a flux meter, otherwise known as spectroradiometer. Okay, so it's a flux meter. So, sorry. What is the unit to express irradiance? What is the recommended irradiance for intensive therapy? What is Billy timer and how does it work? So these are very basic questions: unit of irradiance and recommended irradiance for intensive care. Okay, so the equipment is a flux meter. The unit used for irradiance is microwatts per centimeter square per nanometer. The recommended irradiance for intensive phototherapy would be 30. Billy timer is it measures the cumulative exposure time. It is present in the phototherapy unit itself. It has what is known as electric eye. So when the phototherapy is on, the electric eye opens, and that calculates the timing as such, timing of exposure. Identify the equipment. State the main difference in the equipments shown. So that means this and those two equipments. Okay, so the equipment shown is the nitric oxide delivery system. Okay, so this is, you have a flow meter here. You can there is a flow meter of 0 to 100 and 0 to 500. So with adjusting this flow, you will be adjusting the parts per million for this particular equipment. So the inosis delivers ppm depending on the flow rate, whereas the inovent or inomax, you can dial the ppm. Following that, you have what is the starting dose and how long would you wait for the clinical response. So the starting dose is always 20 ppm. So you have to follow the rule of 20-20-20. So when the oxygenation index is more than 20, that is when you will be starting on INO. And if the starting dose will always be 20 ppm, and if there is an improvement of oxygenation of 20% over the baseline, that is when you will say that there is a good response. So that is why we are saying it as 20, 20, and 20. Next, identify the image. How will you decide the appropriate size and what are the pros and cons? The image is RAM cannula. Many of the units use this for like delivering, like instead of CPAP device or HFNC. But there are certain disadvantages because it delivers variable PWP or CPAP, and it can cause gastric distension and lung over distension. So you have varying size, namely orange, blue, green, and white. So depending on that, you will be using. So the pros is like simple to use, reduces the work of breathing, and good patient complaints. So this is a baby with HAE connected to this equipment. What is this equipment? What does it measure? What is the physiological principles? And name two conditions which are associated with significant reduction from baseline. So the physiological principle and two conditions which are associated with significant reduction from base. So this equipment is, as someone has put, it is NIRS, near infrared spectrometry. It measures the regional oxygenation in terms of cerebral and splanchnic. It uses the same law as by your pulse oximeter. Pulse oximeter also uses the same Beer-Lambert law, and this also uses the same law. And the two conditions would be hypoxia, anemia, hypocarbia, hypotension, or chest hyperinflation. So these are some of the causes why your cerebral regional saturation will go down from baseline. It is either due to a decreased oxygen delivery, which can be due to decreased content or decreased perfusion. So basically, shock status is what you are looking when there is decreased perfusion. So anemia or desaturation for decreased oxygen content. Increased oxygen consumption is due to increased requirement in terms of seizures, fever, etc. So this is reasons for your increased cerebral regional saturation from baseline. Either it is due to increased oxygen delivery or due to decreased oxygen consumption. So identify this equipment. What are the indications for its use in neonates, and name recent technique to use this equipment? Hope all of you are writing it down. Okay, the equipment is an intraosseous needle. It is used mainly for adrenaline or volume expansion during neonatal resuscitation, especially when it is happening later in the newborn period, because we do not have uh, umbilical line and it might have got shriveled. So the recent technique would be to use a battery-operated shotgun or battery-operated driver. Name this equipment. What are the prerequisites for its optimal functionality? What is the common alternative equipment? So this is very common. So you need to know. Okay, so basically it is a syringe pump. Infusion pump we use when we are using a volumetric pump. So the prerequisites is a microprocessor controlled motor with a good battery backup, so that accurate display of infused volume, infusion rate, especially with the alarms are there. So the common alternative is your volumetric pump. And nowadays you have other pumps like smart infusion pump with computerized prescriber order entry, which is known as CPOE, and also some automatic medication dispensing systems. If you feed what medication it is, it will set the number of ml per hour what it has to give on its own. So that is why we are telling it as a smart infusion pumps. Identify the waveforms which is being monitored, which is the down, this waveform. The waveform which is down. So this is a rainbow technology of your Massimo. So some waveform is being monitored here. You have done with that answer. So it is a capnography, ETCO2. So actually it is not ETCO2, it is a capnography as such. So how do we? So when there is a capnography, you can see that it is a square. Okay, so there is point A, point B, and point C. So which point indicates that your end tidal CO2? So the end tidal CO2 is determined by your point B here. So that indicates EtCO2. How it happens is, so during your expiration phase, the expiration begins here. You do not have any CO2 because at that point of time, it is whatever is there in the dead space comes out. After that, there is a peak rise in the CO2 because these are the gas which is exchanged, after which it plateaus. Okay. So here, this particular point, whichever is plateauing here, that is your EtCO2. Once inspiration begins, your the capnography curves falls low down. This is a very important equipment. What is being monitored here? What is the specific advantage of this equipment? What is the recommended minimum gestation age for its use? Okay, so ABR, which is automated acoustic brainstem response. If you have written this down, it is a correct answer. Even if you have written as BERA, it might be only a partial response. So it is used for universal screening. There is specific advantages. It will not, it will detect pathology beyond cochlea. The recommended age is 34 weeks. So I'll just go on what is being monitored here. So I think this is a cerebral function monitoring or AEG. Common situation as we discussed will be neonatal seizures or HIE. The parameters which should be monitored would include amplitude, variability, sleep-wake cycle, and seizures. So rapid fire, this is transcutaneous bilirubinometer. This is laminar airflow. This is OE, autoacoustic emission machine. So this is a servo-controlled cooling device, a Ticotherm. This is a cold light or trans illuminator. Okay.
Thank you, ma'am. Thank you for taking out your time from busy schedule and attending the taking this session, ma'am. Thank you so much, ma'am.
Yeah. Thank you, Dr. Nalina, and for the invite, and thank you, IAP, for the opportunity as such. If there are any queries or anything they want to interact, I'm happy to do it in another 5 minutes, within 5 minutes. If they have any queries or they want some reading material. All of them are tired.
Thanks.
I think best wishes for all of you, whomever is appearing for exam. And especially I would like to greet my presenter who has done reasonably well. There are certain areas which everyone could work on, but well presented.
Thank you, ma'am. And Sarita will be, I think, sending email or contact you to score the student, ma'am. Please do the needful, ma'am.
Sure.
Thank you.
Thank you,
ma'am. Thank you.
Thank you.